Hi, my name is Shiv Shah. I'm a second year medical student, and in this series, I'm going to be talking through a few anatomical structures that you guys are going to be encountering in your dissections. And the way this is going to work is I'm going to be providing a blank worksheet that you can use either on Notability or on a printout to follow along as we track some of the major muscles, arteries, nerves, and in some cases, even veins. The purpose of this series is to introduce this idea of learning by drawing. So, as you're learning anatomy, and when I learned anatomy, I found it really hard to reconcile the three-dimensional structures with the two-dimensional textbooks. But one thing that really helped me is drawing out structures. Now, I am by no means an artist. I'm actually probably one of the poor artists in my class. And I feel that there's often a misnomer that you need to be an artist in order to be able to learn anatomy by drawing, but that's absolutely not the case. A lot of my drawings, as you'll see, are fairly crude, but it's important because and helpful because it allows you to see the relationship of different structures with one another, and it really allows you to scrutinize your own understanding of the anatomy. Are you able to see where these structures originate and insert? Even if you don't need to memorize those, they can aid you very, very greatly in your dissection. And I find that when you spend some time drawing out the structures, you're really forced to look at the individual fibers, where they're going, things that are going across one another. And it really just helps you to retain the anatomy, even in the long term. So, without further ado, we're going to be starting with a little demonstration of how one of these sessions would be run. We're going to be starting with the gluteal region, and I'm going to first walk through the bony landmarks, and then I'm going to look more closely at the gluteal muscles. So, we'll take a look at those three main gluteal muscles, the superficial layers. As you retract them back, you'll start to see the deeper muscles, and those can be a little bit challenging to learn. So, we'll spend a little bit more time on that. And we'll also learn about the arteries and nerves that innervate all of these muscles. They're particularly important in this section because they can greatly have clinical significance with things like walking and gait disturbances. So let's first start by looking at the bony landmarks. So here we can see we have our spine, we have our lower lumbar vertebrae. Here we can see the sacrum as well as the sacral foramina. And at the very end, we have our coccyx. Now, in addition to that, we can look a little bit more laterally. And again, before we start off, let's make sure we understand this is a posterior view because we're doing a gluteal dissection. So we're going to be looking at these cadavers from the posterior side. So posteriorly, here we can see the wing of the ilium. And then in this section, roughly about there. It's kind of the soft line, um, maybe closer to there. We can see our ischium. So our ischium is going to be more posterior to the pubis. And the pubis is a bit more anterior. And you can see that we can see the different rami of the pubis there. That's not as important right now. Next, we're going to look at the femur. So the femur is this bone right here, and we have the head of the femur, which would ideally sit in the acetabulum. And then more importantly, we have our greater trochanter. That's going to be seen best from the posterior side of the femur, and it's going to be a major attachment for a lot of the muscles that allow us to abduct or move our leg away from the midline. And then finally, we're going to talk about the gluteal tuberosity. So when you're looking at your bone boxes, which you should do fairly early on, you're going to see kind of a rise in the posterior part of the femur. That's your gluteal tuberosity, and it's a little bit more superior. When you go more inferior, that's where you'll feel another landmark, the linea aspera, and we'll talk about that in a different section. But you'll feel that gluteal tuberosity along the posterior part of the femur. That's going to be where the gluteus maximus inserts, and so that's an important landmark to just keep in mind. So now let's take a look at our muscles. We're going to start with the gluteus maximus. You can see that the gluteus maximus is a fairly large muscle, and it's extending from roughly this region right about here That's roughly where it is. That's roughly where it inserts. And it's going to extend onto the gluteal tuberosity, which we can see right there. Now, you can also see a second attachment. The gluteus maximus will also insert a little bit more laterally onto the IT tract or the IT band. And that's really mainly a continuation of the tensor fascia lata, which you can see more easily from like a lateral or an anterolateral view. So we're not going to be talking too much about it, but just understand that the gluteus maximus is going to insert on that gluteal tuberosity. Um, and that makes sense because what does the gluteus maximus allow us to do? It allows us to extend our hip. And that's important for things like sitting, excuse me, standing from a sitting position, is so the extension of our hip is really important. And it makes sense because it's inserting onto the posterior side of the femur. So as these muscles contract, we're able to move our hip in a more extended position, as opposed to a flexed position. So now let's take a look at our worksheet and see if we can sketch out the gluteus maximus. So when I do these sketches, like I said, this is not an exact science. Um, I do very rough and very crude sketches, but when I do my muscles, I like to stick to a certain pattern. I like to, in most cases, for the large muscles especially, I like to draw out the striations. That way you can see exactly the way the fibers are oriented rather than shading it in. But to each their own, everyone has their own preferences. But let's try to trace out some of the key landmarks for this gluteus maximus. So if that's roughly where my um, gluteal tuberosity is, and I know that my gluteus maximus originates along that line roughly, I can start to draw my fibers out. And again, it doesn't need to be an exact science. Usually what I like to do is I like to get the borders and then go a little bit more rapid with these other sections. As you can see, very, very crude. Um, and so the key idea is really to see those origins, see those insertions, realize that the gluteus maximus is a very large muscle, and it's going to be the first thing that you encounter in your dissection. And you're going to see that it really does insert into that gluteal tuberosity fairly well. And remember that there's also these lateral projections that insert onto that IT band as well. So that's what I'm drawing out right there. So as you can see, very crude, very rough, but that's roughly what our gluteus maximus is going to look like. So in the dissection lab, what you guys are going to be doing is you're going to actually be freeing the gluteus maximus from its medial attachment. As you retract it back, you're going to start to see the underlying gluteus medius and eventually the minimus. So let's take a look at those two muscles. We have our gluteus medius and our gluteus minimus. So when we look at the animation on the lower part of the screen, we can see that we've basically taken off the gluteus maximus, and what we're left with is we see this gluteus medius. So you can see that the gluteus maximus is attached a lot more medially. The gluteus medius is attached a little bit more superiorly, kind of towards like the ala or the wing of the posterior part of the ilium. And then the minimus is very, very flush with the ilium. So let's take a stab at these two muscles. So with the gluteus medius, again, it's really going to be originating from this part of the ilium. And the minimus is going to be very, very flush with the ilium. Now, what I do want to point out is where these two muscles attach. So when we talked about the gluteus maximus, it attached onto the gluteal tuberosity, but the medius and the minimus, notice that they are attaching. Let me do this in a darker color. Notice that they are attaching at that structure right there. And remember what that is. That's our greater trochanter. Again, this is a structure, a landmark on the femur that you're going to see best from the posterior side. And as these muscles attach onto that greater trochanter, you can imagine as this muscle pulls, we're able to abduct our femur away from the midline. So these two muscles are very important for abduction of the leg. So let's take a stab at some of these drawings. So with our gluteus medius, again, it's going to originate really at the superior part. of the ilium, and we can continue to follow those projections down. And notice that I'm trying my best to concentrate the insertion on that greater trochanter. So in my brain, hopefully it's sticking that these fibers insert at the greater trochanter. And that's what one of these things that I've learned really helps for myself when I'm learning anatomy is that when I focus on where my striations are going, I naturally just kind of memorize the origins insertions without, even really trying much. So that can be very helpful. Now we can take a look at the gluteus minimus. And again, the minimus is also going to insert onto that greater trochanter, and it stays very flush with the ilium. So there we go. That's roughly what our minimus would look like. So we have our medius over on the left and the minimus on the right. All right. So let's continue on. Now we can take a look at some of the deeper muscles of the gluteal region. Now, when I was learning anatomy, I would look at maybe a Netter's page or one of these pages and very quickly get overwhelmed with all of the different uh, all of the different terms and labels and just the sheer complexity of it is quite intimidating. So one of the things that I like to do is I like to take things in chunks. So let's take a look at just the main muscles that we're going to be examining. Now you can see that we have most of the labels removed, but we have a few key actions that we've been able to accomplish to get this diagram. We've been able to retract the gluteus maximus right there. And we've also been able to retract or reflect both. We can use either term. And we've been also able to reflect the gluteus medius. It looks like in this way, it's been transected and then, reflected. Here we're still able to see, let me do this in a darker color. Here we're still able to see the gluteus minimus. And again, that's flush with the ilium. And now I can see all of these structures, and it's fairly concentrated. There's a lot of stuff going on. So let's take it step by step. So first, let's look at the muscles. Notice that we have this muscle right here. And to me, it always looked pretty triangular. So that's our piriformis muscle. It's a triangle-shaped muscle that also inserts onto the greater trochanter. And this is going to be one of the key muscles that I bring up over and over again because a lot of the orientation of our gluteal anatomy is going to be relative to that piriformis muscle. IDing that muscle is key because you look at the vessels above, below, and you can identify a lot of the key things I like to tag on practicals. Um, and then after that, so we have our piriformis right there. Notice that we have four more small muscles in that region, right? And the key with these muscles is kind of following the pattern that they go down. So we have these two small muscles here. Notice that they're fairly small muscles. Those are our gemelli muscles, or the singular is gemellus. And how I remember that is the gemellus, or it's kind of sounds like gem. Gems are small, so those are our small muscles. And then we have this unusual muscle that takes kind of a circuitous path. That's this muscle right here is our obturator internus. And when you guys do the gluteal dissection, what you'll probably see is you're going to see a sliver of the tendon of the obturator internus. And that's totally fine. When you guys look at the hemisections of the pelvis and the prosections, then it might be a little bit more easier to see the full muscle belly. But the muscle belly terminates fairly early, and then it turns into a tendon. So that's our obturator internus. And then finally, we have this square-shaped muscle right here. That's our quadratus femoris. And it makes sense, right? That it even looks like a quadrilateral. And it's in the it's attached to the femur. So quadratus femoris makes a fair bit of sense. So how do we memorize all of this? Well, there's a little a series of letters that I memorized, and it's P, Go, G, Q. If you just keep saying that to yourself over and over again, it sounds fairly silly, but it's a good way to memorize these muscles, and it's in this order as well. So P for piriformis, G for gemellus, and we have two of them. We have our obturator internus, and we finally have our quadratus femoris. So P, go GQ, P, go GQ. So when you're looking at these structures in the lab, identify your piriformis. Then you can find the gemellus, the obturator, the gemellus, and then the quadratus, right? Notice that I listed gemellus twice. Well, one of them is superior, so this one's superior. This one is inferior, so we have a superior gemellus and an inferior gemellus. That's easy enough. Obturator internus, really what you're going to see is the tendon of obturator internus. And so if you think about it, think of a little tendon sandwich. The tendon is in between, sandwiched in between your two gemelli. And then finally, you look for that square-shaped muscle. That's the quadratus femoris. So P, go GQ. When we look at this piriformis, this triangular muscle, we can look at and identify the vessels above and below. So above, we're going to see the superior gluteal vessel and nerve. Inferiorly, we're going to see the inferior gluteal vessel, inferior gluteal artery and nerve, as well as the sciatic nerve. So these are going to be best seen in our drawing. So let's continue on. So I'm going to break my rule. It's not really a rule, but I'm going to ignore my rule for a moment because usually I do like the striations, but the piriformis is a fairly focal muscle. So I actually like to shade it in. So again, notice that it's triangular shaped. It's inserting in that greater trochanter region, and it's originating. Look at the origin. It's kind of that like the lower part of the sacrum. Uh-oh. Let's try that again. Again, when you're drawing to learn anatomy, these can be crude and no one's going to judge you, which is the nice part. Next, I'm going to draw in my two gemelli muscles, and the gemelli muscles are fairly short. They look something like that. Very, very short muscles. And in between the gemellus, you're going to see but in between the two gemellus muscles, you're going to see the tendon, right? So the tendon is sandwiched between the two gemelli muscles. And then we have the muscle belly, and that is really our obturator internus. Finally, we have our quadratus femoris, and basically what I'm looking for that nice rectangle, that quadrilateral. That's my quadratus femoris. So we have our P, go, G, Q. P, go, G, Q. P, go, G, Q. Piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. Now, the piriformis, the reason I keep harping on that is because if you can identify the piriformis successfully, which you will all be able to because it's the triangle muscle in the gluteal region, the deep gluteal region, you'll be able to identify the gluteal artery nerves and the sciatic nerve. So superiorly, we're going to see the superior gluteal artery. And then inferiorly, we're going to see the inferior gluteal artery. The superior gluteal artery is going to go towards the gluteus medius and minimus, while the inferior gluteal artery goes to the gluteus maximus. And tracking with those arteries are their adjacent nerves. So we have the superior gluteal nerve. We have the inferior gluteal nerve. I'm not going to write the whole thing out, but we have our arteries and our nerves, and these are going to be superior and inferior relative to the piriform. So again, that's why the piriformis is so important, because if you can ID that, you can ID a lot of these other vessels. And then finally, I'll do this in a slightly different color. I'll do it in orange. We have the sciatic nerve. The sciatic nerve is practically impossible to miss. The sciatic nerve, which is the big nerve in the back of the leg, the sciatic nerve originates in the lumbosacral trunk, and it's going to emerge from underneath the piriformis and travel down the back of the leg. There's a whole trajectory to the sciatic nerve that we can take a look at in a different section. But the sciatic nerve is important because it's going to feed a lot of the hamstring muscles, a lot of the calf muscles. It's going to give off an anterior division, which is going to help with our anterior leg muscles. It's called the common fibular nerve, and I'm sure you'll learn about that at some point. But anyways, the sciatic nerve is very, very big and very important as well because this piriformis muscle sometimes I believe in it might be bicyclists or some sort of athletes, that muscle can get hypertrophied, push on that sciatic nerve and cause sciatica, and that can be fairly discomfort uncomfortable. So knowing the anatomy is really important for these structures. The superior gluteal nerve, it's very important to know that those are going to be especially important with the gluteus medius and minimus. It innervates those two muscles. So any injury to the superior gluteal nerve is going to cause issues with abduction of the leg, while injuries to the inferior gluteal nerve is going to cause issues to the gluteus maximus. So that's going to be you're going to have more challenges with extension of the hips, which makes going from a sitting to a standing position more challenging. That's usually how the USMLE likes to put their vignettes, something related to that. So this is a rough outline of the gluteal region. It's not everything. It's not fully comprehensive. As you can see, there are some other structures we didn't talk about. There are the pudendals. We have some more feeder arteries, and of course, you have your thigh muscles. Um, and we briefly mentioned the linea aspera and its relation to the gluteal tuberosity. But this is just a sample of how you can use drawing to help you understand the relationship of these different structures. And again, you can see by the how crude my drawings are. You don't have to be an artist to be able to understand anatomy by drawing, but it can be a very helpful tool. And the more time that you spend with looking at these different diagrams and trying to draw stuff out and chunking it into muscles and then arteries and then nerves, you'll find that anatomy can become a lot more easy to understand, and it will help you a lot more with your dissections because you'll have a great understanding of the relationship with one another.